Hello, everyone. I'm Zoe, a peer health educator with the TitanWell sexual health team. My pronouns are she, her, hers, and today we're going to be discussing the lowdown on getting down. Here is a pretest just to record the previous knowledge level before we get into the presentation. You can scan the QR code using your phone or enter the bit.ly link into your browser. It should just take about 3 to 5 minutes. So this slide is just further reiterating who we are. So we're TitanWell peer health educators. We work with students to help empower themselves to make healthier decisions. We also work with professional staff at the Student Health Center to ensure you have the most up-to-date knowledge. We're also students ourselves, so we go through a lot of the same struggles. We're on this health journey together, just trying to make better choices. So this is an overview of what we're going to be discussing today. We're going to be talking about perceptions and misconceptions about sex, percentages associated with sexual activities on our campus, sexual behaviors and risks, common STIs and rates associated, contraception and barrier methods, STI and HIV testing, and also resources on and off campus. Sex education across the United States. So as you can see, we have a graphic here demonstrating every state's grade that they've received on comprehensive sex education. So the grade corresponds with the color. So in California, we're blue, so that means we have an A plus grade, and that is based on teenage pregnancy rates, unintended pregnancy rates, access to contraceptives, access to emergency contraceptives, and a lot of different laws and policies that are listed on the right-hand side of the slide. So even though we go to school in California, a lot of us have come from different states that might not have had as comprehensive a sex education as we might have had. So it's important to keep this in mind as we're moving throughout the presentation. Everybody's doing it, right? So this is often wrong. So there are a lot of different perceptions and misconceptions about sex on our campus. So students often overestimate the number of peers who participate in sexual intercourse, whether that be vaginal, anal, or oral. So whether you're currently having sex, abstaining, waiting, or you have no interest in sex, there are plenty of other students in your situation. We are a campus of 40,000 students. So there are definitely other students in your position who share your values, so you are not alone. So who's really having sex? Here we have percentages of those who have had sex in the past 30 days. For vaginal sex, it's 48%, anal sex is 5.3%, and oral sex is 44%. And these are calculated on our campus. So next to it is the real life number that would represent on our campus. So that's 19,000 students who have engaged in vaginal sex in the past 30 days. And just to reflect, is this more than you thought? Is this less than you thought? Just kind of reflect on what that number means to you. Moving on to percentage of those who have never had sex. So vaginal, 33.6, anal, 71%, oral 31.5%. And the number on our campus is represented in blue on the right-hand side. So again, just reflect and think, is this more than you thought? Is this less than you thought? Some of these numbers can be kind of shocking to students, but just further reiterating, you're not alone. So whether you're never having sex or you're having sex currently, there are definitely a lot of students in your position. Next, we're going to get into the sexual behaviors and the risks associated with those behaviors. Here we have different forms of sex and the risks associated with them. So for vaginal, we have pregnancy and STIs, and we have an asterisk next to pregnancy because if both participating sexual partners have vaginas, it would be referred to as vaginal sex. However, pregnancy would not be a possibility in that situation. So we have an asterisk next to it. And also for oral and anal sex, STIs are going to be a risk and possibility as well. Here we have a risk continuum. So we have high, moderate, and low risk and the different sexual activities associated with them. So under high risk, we have unprotected sex of all forms, oral, vaginal, and anal. For moderate, we have sharing of sex toys, hand to genital contact, and barrier methods. And then for low, we have abstinence and activities that do not involve the exchange of bodily fluids. So abstinence is low for us instead of no risk because abstinence means something different for everyone. Abstinence can mean you abstain from oral sex but participate in anal or vaginal sex. So that's why it's a low risk rather than no risk, just because that definition can change for people. And this is a continuum because these different risks can change from high to low or low to high, just depending on the different measures that are taken. For example, unprotected anal sex is a high risk, but if you involve condoms, that high risk can go down to moderate or low risk if the participating members know how to properly use a condom. So those things can change. It's constantly changing, and your risk of STIs is constantly changing as well, depending on what contraceptive and barrier measures you're taking. Here we have different modes of transmission, so we have them listed in 5 categories: skin to skin contact, exchange of bodily fluids, vaginal, oral, and anal sex. As you can see, a lot of the STIs are overlapping in different categories. One category that I'd like to mention is skin to skin contact. I don't think this is one that a lot of students learn about, so it's an important one to look into. We have herpes, syphilis, and HPV listed here, and you definitely don't need to memorize anything on this infographic. It's just nice to keep for reference. Here we have a terminology slide for MSM and WSW. So MSM refers to men who have sex with men, and WSW means women who have sex with women. And we use this terminology because behavior dictates risk, not sexual orientation or identity. So behavior and identity are not always the same. So not all women who have sex with women would identify as gay, lesbian, or bisexual. So we use this terminology because identity is separate than behavior that is going to indicate a risk. Here we have a fact that we include in every presentation. It's 1 in 2 sexually active young people will get an STI by the age of 25, and most will not know it. So this isn't to scare anybody. It's just a fact that we like to use because of the phrase most will not know it. And why most will not know it is because a lot of STIs are asymptomatic, and B, not enough people are getting tested regularly. So what regular testing means is every 3 months or with each new partner, whichever is coming first, if you are not in a mutually monogamous relationship. However, if you are mutually monogamous, it's every 6 months or once a year. We're going to get into some common STIs and rates. So we have more information at the bit.ly link below. It's the infographic that you'll find on the next slide. Here is the bit.ly link. So the bit.ly link is case sensitive, so make sure to capitalize STI if you want to bring it up on your phone. Here are the most common STIs and a little breakdown of them. So how it's spread, the different treatment, rates associated with it, and then possible consequences if it is left untreated. First, we're going to get into chlamydia. So chlamydia is the #1 diagnosed STI on our campus. It's often found in the throat, but it's important if you use it that you test it. So if you are engaging in any form of sex, anal, oral, or vaginal, that you're getting those areas tested. So we have a graph here representing the rate per 100,000, and this is just in the United States. So as you can see, there are much more women being diagnosed than men. However, the most popular age group is 15 to 29. We've highlighted that because that is about the college age group, the high school college age group. And we like to ask students why they think women are getting more diagnosed with chlamydia. We don't necessarily have the answer, but it's interesting to guess and hypothesize. I think some interesting ones that we've thought of is women go to the doctor more often than men, which is scientifically proven. So maybe women are just going more often, so they're getting more diagnosed. Or also maybe with chlamydia, it's a bit more symptomatic for women, so they're feeling those symptoms a little bit more. They're more likely to get tested. Next, we're going to get into gonorrhea. So gonorrhea is the second most diagnosed STI on our campus. Also, gonorrhea, fun fact, has become antibiotic resistant in some strains. So it's very important if you feel a symptom or if you're sexually active that you're getting regularly tested. Here we have a graph of reported cases in the United States in 2017. So we again highlighted the age group of 15 to 29. This is the kind of late high school and college age group. So this one is much more distributed amongst men and women as compared to chlamydia. So possibly for gonorrhea, both men and women are getting the same amount of symptoms. So they're going to the doctor at an equal rate. Now we're going to get into birth control and contraceptive methods. If you'd like to follow along with an infographic, you can type in the bit.ly link. It is case sensitive, so BCM needs to be capitalized, and we'll go into it briefly on the next slide. Here is what the bit.ly link looks like. It just gives a basic overview of some different types of contraceptive and barrier methods, and it gives their effectiveness rates, why you would use them over another form, and also the contraindications of why you would not want to use it or any cons that are associated with it. So here we have what works well. So these are the birth control methods that are going to work better than others, and that is because these have less chance of human error. So all of these are going to be inserted through a procedure with a doctor or practitioner. So there's less chance of having any human interaction that would make the birth control method less effective. The first method is the implant. So this is a hormonal form of birth control. It's inserted under the bicep on the inner arm. It is about the size of a matchstick. It's 99% effective, basically as effective as sterilization when it is implanted, and it lasts 3 years. It is also considered a LARC, which stands for long-acting reversible contraceptive. So this means as soon as the form is removed, it is completely reversible, so you could potentially get pregnant the day you get it removed. So it is important to be diligent about getting it reinserted or getting on another form of birth control altogether. Next, we have the IUD. So this is the intrauterine device. It lasts ranging from 3 to 12 years, just depending on the brand and the form of IUD you get. So there are two forms, hormonal and non-hormonal. So hormonal is progesterone only, and it lasts about 3 to 5 years. It depends on the brand. There are various brands such as Skyla, Mirena, and Kylena. All are a little bit different sized to fit different size uteruses and different shaped uteruses. There's also the non-hormonal form of the IUD, which is made of copper. It's known as the Paragard. So this version can last anywhere from 10 to 12 years. I've seen it recommended sometimes for 15 years. These are also considered LARCs, so they are long-acting reversible contraceptives. It's important to either get it reinserted once it has expired or to get on another form if you're concerned about getting pregnant. It is inserted with a long device through the cervix and it sits in the uterus. It's typically inserted on the menstrual cycle, and it is as effective as sterilization when it is implanted. Next, we have sterilization. So a fun fact, sterilization is the most used birth control method internationally. However, it's not recommended for our age group, but it could be an option later down the line. And it can be for men or women as a vasectomy or a tubal ligation, which is known as getting your tubes tied. Lastly, we have abstinence. So this is 100% effective if abstinence is practiced as complete abstinence from all sexual activities. However, it can mean different things for different people. So it's important to understand that definition and know that if you're abstaining from vaginal sex, you could be protecting against pregnancy. However, other forms may not be protecting. What works okay? So these methods are not going to work as well as the previous ones discussed because there's more human error associated with these methods. However, they still work well in conjunction with a barrier method, and we'll go into that a little bit later. First, we have the pill. So you take the pill every single day. There are two versions of the pill, the mini pill and the combination pill. So the mini pill is progesterone only, and the combination pill is progesterone and estrogen. So depending on your situation, your provider may prescribe you different form of pill, and all pills have different forms of hormones and different percentages of each. So depending on your situation and where you are in your birth control journey, you might be prescribed different hormone percentages. This is taken every day at around the same time. There's about a 4-hour gap, 2 hours before and 2 hours after you would normally take the pill, where you're safe to take it, but you want to aim for the same time every day. So we recommend maybe putting an alarm on your phone, or even possibly setting them next to your toothbrush, so when you brush your teeth at night or in the morning, you take your pill with you. Pill is a nice option because you can actually control your period with this method. So you know when you're going to get it, exactly the week, the day of, you know when you're going to get it. But also you can decide to skip it if you're going on vacation and you don't want to have it. You can just start another pill pack instead of taking the placebo week, which is the white colored pills in the picture above. That's when you would normally get your period. So you can skip that week by just starting another pill pack altogether. The patch is the second method, so this is changed off every week. It is typically placed on the shoulder, the butt, or the hip. However, it is only available in the color seen above, so not everybody's skin tone matches that color. So if discretion is important to you in your birth control method, it might not be the best option. It is also hormonal, and you would reapply this every week, and then you would skip the week of your period week, so you would skip the 4th week of every month, or you could just take the patch and put it on that week, and then you could skip your period if you wanted. So controlling your period is also an option with the patch. Thirdly, we have the ring. So this is put in every month. It is self-inserted for 3 weeks and it's removed for 1 week, and that's when you get your period. So you can also control your menstrual cycle with the ring as well. It can be removed during sex, but it must be placed in right after. So about 2 hours, it can be outside the body, but it needs to be placed back inside. So that's where the human error can come in. Maybe you take it out and you forget to put it back in right away. That's when you can get the less effective rates. Also, the ring isn't as discreet because you typically get it in a pack of three, a 3 month supply, and you have to keep them in the refrigerator if you're not using them. So, if you share a fridge with other people and you don't want them to know you're on birth control, that might not be as discreet for you. And the last method is the shot, also called Depo-Provera. It's every 3 months, so you have to keep up with your appointments. It's not 3 months on the dot. They do allow a little space in your doctor's appointments, but you really do have to keep up with it, or else you're going to have less effective rates associated. Also, with the shot, it's not recommended that you're on it for more than a few years at a time because it is known to deteriorate bones and promote bone loss. However, that is something that your provider will discuss with you and get you on a calcium supplement at that time as well. What does not work as well? So we have pulling out first. So pulling out is essentially when your partner would pull out before they ejaculate, so they wouldn't ejaculate inside of you. However, as you can see, there's probably a lot of issues associated with this. Your partner may not know exactly when they're going to ejaculate. They have to be very in tune with their body and bodily signals, so that can be an issue. And also, pre-cum can contain sperm. So even though they may not have fully ejaculated, they may have pre-cum, which has sperm in it, that during sex can be released into getting someone pregnant. Next, we have fertility awareness method. This isn't as a popular method. However, I know it is more popular amongst the individuals who want to be hormone free when they're on birth control. So this method involves taking your basal body temperature. This is different from just your normal bodily temperature. You take it every day and you note it either through an app. So there is a FDA approved app called Natural Cycles, or a notebook to measure when your body ovulates. So there are natural increases. It's just about like 0.4 increase in your basal body temperature when you ovulate. So then you'll know when you're fertile or not. That way you can plan when you have sex and when you don't around when you're ovulating. This does involve a lot of work and it can be really complicated, especially for busy college students. But it can be used when you're planning a family. So if you want to map out your ovulation and you have sex at that time, hopefully to have a baby, that it works well in that case. But I think using it as a birth control method, it is a bit complicated. The diaphragm is the third option. It's not really used by our generation as much, but it used to be used in the 60s and 70s quite a bit. You do have to get fitted by a physician for a diaphragm or a cervical cap. Also, application can be a bit difficult. You insert it yourself, and it can be a little tricky to get it in the right spot. And it's basically a guard that lays over your cervix, and it doesn't allow sperm through. So you can look up pictures of what a diaphragm looks like. We have a small photo here. It's the bottom left, and it just looks like a little dome shape, and that would just rest against the cervix to guard it from any entering sperm. And lastly, we have condoms. So condoms are in this category because people don't really know how to effectively use condoms. We will be showing you later how to effectively use them, but they are great at preventing STI. So they're great in a barrier method, but to prevent pregnancy, if you don't really know how to effectively use them, they can be a little bit difficult at preventing pregnancy. The rates can differ a lot due to that human error. All these methods may be not working as well on their own, so they might not be as effective on their own, but if you pair them with a different method, let's say you use a condom and you have an IUD, that's really going to be great at preventing pregnancy and at protecting against STIs. So partnering these methods up with another method is effective. What does not work at all? So sex during your period. Sex during your period isn't going to work at preventing pregnancy because ovulation can come at different points throughout someone's cycle if they don't have a perfectly regular cycle, and not many people do. So sperm can live in your body for 3 to 5 days. So an example could be you have sex on the last day of your period and 4 days later you ovulate because you have an irregular cycle. You could potentially get pregnant because the sperm can live inside you for 3 to 5 days. So it's not effective at preventing pregnancy. Peeing after sex. So the urinary system and the vagina are two different anatomical structures. So peeing after sex isn't going to take any ejaculation or any sperm out, but it is useful when preventing UTIs, which are urinary tract infections. So it's helpful to pee before and after sex to prevent UTIs, but it will not do anything if there is sperm inside of the vagina. Douching is something I don't think a lot of people use nowadays, but it was quite popular in the past. So douching is essentially when you inject a scented liquid into the vagina in hopes that it would make the vagina smell better or that it would clean it out. A lot of them say they can balance the vaginal pH and things like that. However, douching can actually disrupt the vaginal pH because it is very sensitive. There's a very sensitive ecosystem inside the vagina, and introducing any unique liquids or any soaps can actually disrupt that vaginal pH. And if there is sperm inside the vagina, it can serve as the exact opposite. It serves as a jetpack. So the sperm would shoot higher up into the vagina, closer to the cervix, potentially up into the uterus, which would promote a fertilization of an egg. So we don't recommend douching for prevention of pregnancy, but we also don't recommend douching for any hygiene or sanitary reasons either. Lastly, we have doubling up. So doubling up would mean wearing 2 external condoms, an external and an internal condom, or 2 internal condoms. It would essentially mean using 2 barrier methods when you really should only be using 1 because the friction can cause the condoms to break. So this isn't going to be effective, and it's going to involve that human error aspect as well. Here we have a few different forms of emergency contraceptives. First, starting with the copper IUD. So this is the most effective form of emergency contraceptive, and it's a 2-for-1 because it also is protecting you for an additional 12 years as a birth control method. So you get it in as an emergency contraceptive, and then you can keep it for 10 to 12 years afterwards. So it's a really nice option. However, it can be difficult to get into your doctor in that short of amount of time. Typically, you want to use this method within 5 days of having unprotected sex. So getting an appointment, getting all the preliminary procedures done, it can take a while. So it might not be as realistic for a lot of people. Moving on to Ella. So Ella is the most effective emergency contraceptive pill. You do need a prescription for this one. So it can be a little difficult to get a prescription in the 5-day amount of time. However, you can get an online prescription through a few different places, and there is resources on Planned Parenthood to get an online prescription for Ella as well. And lastly, we have Plan B. This is the most accessible form of emergency contraceptive. I think we've all heard of this one. It is available over the counter at the Student Health Center, actually. So we have it available for $25 instead of $50, which is a really great price. It works best within 3 days of unprotected sex, however. So you don't get that 5-day span. It's going to be best within 3. Something important to note as well is emergency contraceptive is helping you from becoming pregnant. If you are already pregnant, it will not work at all. It's not an abortive type of prescription. It's going to be preventing a pregnancy from happening. Common symptoms with birth control. So we have listed here a few different common symptoms. We have spotting, bleeding between periods, heavier periods or no period. I know with heavier periods, the copper IUD, the non-hormonal IUD, is associated with heavier and longer periods, whereas no period is associated with the implant and also the hormonal IUD. We have acne. However, birth control pills can actually be prescribed to prevent acne. So there is a pro and con for that one. Mood swings, cramps, headache, and sore breasts. Now, these don't happen to everyone who gets on birth control. However, they are most common within the 3 to 6 months of first trying out a birth control. So it's important to keep an open mind. If after 3 months there are some symptoms that you just cannot live with, your periods are so heavy, you just can't function throughout your normal day, then it would be best to discuss with a provider about your options. But it's really important to keep an open mind for about 3 to 6 months and let it kind of run its course, let the hormones adjust so that you can get the full effect of what it would be like. How does it work? Here we have a few different ways that hormonal birth control works to prevent pregnancy. One, it's going to prevent ovulation, so an egg is never going to be released down the fallopian tubes. Two, it thickens cervical mucus, so the mucus is thicker and harder for sperm to swim through. And finally, it's going to thin the lining of the uterus. So if an egg is fertilized somehow, the uterus lining is so thin that it cannot implant into the uterine walls. And this is also why periods are typically lighter and shorter on hormonal birth control. How non-hormonal birth control works, so there is the copper IUD. That is essentially you're going to have the same bodily functions. You're going to ovulate normally. Your cervical mucus isn't going to change. The lining of your uterus isn't going to change. However, it creates an inflammatory atmosphere in the uterus with the copper, and the copper also reflects sperm away. So that's how it is working to prevent pregnancy for the non-hormonal birth control option. However, this graphic displays the hormonal birth control. Here are some common birth control myths. I need to take birth control at the same time every day. So you need to take your birth control within a 4-hour time period. So let's say you take your birth control pills at noon every day. You have a 4-hour period between 10 and 2 that you can take those birth control pills and still be an effective window. So like I mentioned before, it's important to set an alarm, set them next to your bedside table, something like that. But taking them exactly on the dot every single day isn't necessarily necessary. Birth control works immediately when I start taking it. For an IUD or an arm implant, it's going to work immediately if you get it inserted on your period. However, for the ring, the patch, the pills, you have to wait a little bit of time in order for it to be effective. And you can talk to your physician about this. Typically, it would take about a month for it to be effective. Birth control will make me gain weight. This is not true with any form of birth control except the Depo-Provera shot. That's the only form of birth control that is associated with weight gain, and it's typically about 5 to 10 pounds, but that doesn't happen to everyone. So if you're interested in the shot but you're concerned about weight gain, talk to your provider and see what they can recommend. I won't get my period on birth control. Most forms of birth control, you'll still get your period, and some you can manipulate your period. So with the pills, the patch, the ring, your period will be the same length unless you want to change it and skip it for 1 month. However, with some hormonal IUDs, you can lose your period, and with the non-hormonal, your period can intensify. So it depends if this is something important to you, if getting your period on time every month is very important to you, then talk to your provider about what options are there for that. Birth control will affect my fertility. Birth control will not affect long-term fertility. They are considered LARCs, so they're 100% reversible. However, some other forms just take a while for the body to adjust. So getting off the pill, you might not get pregnant for a little bit, depending how long you were on it. However, it's not affecting your long-term fertility. IUDs are only for women who have had children. So IUDs were in the past made in the same size, typically a size that was larger to inhabit a uterus that had already carried a child. However, now IUDs are made in numerous sizes for uteruses who have not had children. So for college age people, and these are Kylena and Skyla, and the Kylena is actually the method that we insert at the Student Health Center. Facts on wraps. Now we're going to be getting into some barrier methods and different types of condoms. Condoms. Here we have internal and external condoms. So internal condoms have an effectiveness rate of 95% with perfect use and 79% with typical use. They're also typically called the female condom, however, they are for anyone who has a vagina. It is only available by prescription, unfortunately, and it is only a one size option. However, typically one size fits all works for most people. And we will be detailing later on with photos how to properly insert an internal condom. Next, we have the external condom, also known as the male condom. However, it works for anyone with a penis, and it also can work on sex toys as well. The external condom has an effectiveness rate of 97 or 98% with perfect use and around 85 to 82% with typical use. It's available in latex and non-latex and also lambskin. However, we don't really recommend lambskin because it does not protect against STIs. Size does matter when it comes to condoms. So there are 3 different sizes: snug fit, regular, and XL. So trying different sizes, making sure it's not too loose or too tight so that it can be really comfortable. The more comfortable it is, the more you're going to use it. And what's in a brand name? So all condom brands that are FDA approved are similarly effective. They're probably all made in the same exact factory. I know several brands use the same factory. So even though you may feel confident using Trojan because you've seen all the commercials, that doesn't really mean there's going to be a difference between Trojan and Lifestyle. However, whatever condom brand you feel comfortable using is the one you should use. Also, we'll be showing you how to get condoms at the end of this presentation. We have a resource at the health center where you can get free condoms, and we're going to talk next slide about the 10 steps of proper condom use. Ten steps of proper condom use. Step number 1 is to talk. Here you're going to be establishing consent and boundaries with your partner or your partners. So you're talking about what you like, what you don't like, making sure everybody's on the same page for what's going to be taking place. Step 2 is to check the expiration date. So for external condoms, this is going to be on one side of the package, and for internal condoms, it's going to be typically on the little side flap. Step number 3, squeeze the condom package. So you're going to squeeze it flat to make sure you can feel an air bubble inside. If there's an air bubble present, it means that there's no holes, the lubricant is intact, and overall it's good to use and is effective at preventing pregnancy and STIs. If you can't feel an air bubble, it typically means that there is a hole or that is expired. Step number 4 is to carefully open the package. So this doesn't mean with your teeth, it just means with your hands along the perforated edges. Step number 5 is to pinch the tip of the condom. So when pinching the tip, you want to make sure that you're going to be rolling the condom down the correct way. So we like to say this looks like a sombrero and not a party hat. You want to make sure the condom is rolling underneath on the sides and not over. Number 6, carefully unroll to the base of the penis. Then you would have intercourse. Ejaculation may or may not occur. Step number 9 is holding on to the base of the penis, and 10 is withdrawing. So you're holding on to the condom when you withdraw so that the condom does not get stuck in your partner, and then you're going to throw the condom away into a trash can. It's important not to reuse it, and it is also important not to flush it down the toilet. In the next slides, the next 2 slides, we have visual demonstrations of the 10 steps. Here we have the steps on how to do an internal condom. So step number 1 is also talking, establishing consent and boundaries with your partners. Next, you're going to be checking the expiration date and also squeezing the package. The expiration date will be on one of the flaps on the side, and also there will be an air bubble in the female condom. Carefully opening the package along the perforated edges. When you remove it, it's going to look like this. There's going to be a large plastic ring on the outside, as you can see in the third image, and then there's also going to be another ring on the inside of the condom. Typical to like a NuvaRing style. It looks like the NuvaRing birth control method. When you insert this, you're going to twist that internal ring into a figure 8 shape, insert it into the vagina, lead it with a finger. It's going to rest against the pubic bone in a very comfortable position. It shouldn't be uncomfortable, similar to when you insert a tampon. If it is uncomfortable, it probably means it's not in the right place. And then when you penetrate, you're going to hold the outside. As you can see in the last image on the bottom right, it does stick out of the vulva slightly. So you're going to hold the condom outside of the vulva when you penetrate so that you're not flipping it to the side and actually penetrating the vagina instead of the condom, because these condoms typically feel most lifelike. This condom can also be used for an anus. However, you would maybe want to remove the inside ring. You can keep it in if you want, but typically it's most comfortable if you remove the inside ring and then insert for anal sex. Barrier methods for oral sex. So we have a few different barrier methods that are used. The first is dental dams. So this is used for oral sex with a vulva. It looks like a fruit roll-up. It's in a small Ziploc bag, and when you take it out, it unravels to a long sheet of latex. It also can be used for an anus as well. It does only come in latex, so if you are allergic to latex, we have a DIY demo for dental dams in the next slide. You can use a non-latex condom and do the DIY dental dam, and then use flavored lube, so it's a similar effect. And second, we have flavored condoms. So this is used for oral sex with a penis or a sex toy, and the sugars can disrupt the vaginal pH, and it can cause infections, which is why that flavored condoms should only be used for oral sex and not vaginal sex or anal sex. If you are allergic to latex, unfortunately, flavored condoms only come in latex, so you can use a non-latex condom and apply flavored lube similar to the dental dam. Lube it up. Here we have different types of lube, good lube and bad lube. So good lube would be defined as being water-based or silicone-based. We have two brands at the bottom, Astroglide and Wet. And bad lube would be an oil-based lube, because oil-based lubes break down condoms. Whether they're latex or non-latex, they will break it down. And Vaseline and food are also bad lubes because they can cause infections and also irritate the skin, irritate the vagina or anus. So sticking to water-based and silicone-based lube is best. However, if you don't have lube, saliva also works just as well, and it's also cost-effective. Regardless of what condom you're using, internal, external, dental dam, it is important to know that you need to store them in the correct place. So you need to store them in a cool, dry place. Definitely nowhere too cold, nowhere too warm. In your purse is also dangerous because you can have a pen or a pin that can poke a hole in it. So keeping them in a hard shell helps as well. Altoid cases are a great shell to keep a condom in. After using condoms, you want to make sure that you're disposing them correctly as well, so you don't reuse them. This especially goes for internal condoms. A lot of people think that they're reusable because of how large they are, but they are not. So you need to trash them and never flush them. They can come back up the toilet, and if you live with other people, it can be very uncomfortable. So you want to make sure that you're storing them and getting rid of them in the correct way. Know your baseline. So testing with your partner can be a way to strengthen a relationship. It's a great date idea, and it also makes sure that both of you know your baseline and you can inform your partner and other partners of where you're at. So getting tested, as we mentioned before, getting tested regularly is very important. So that's every 3 months or with every new partner, whichever comes first. And if you're in a mutually monogamous relationship, it means every 6 months to every year. We also have a little acronym that we use when asking for consent. It's called consent fries. So that means it is freely given, so no coercion, no pressure. Reversible, it can be taken away at any time throughout sex. Informed, everybody knows what their boundaries are and what they like and don't like. Enthusiastic, so it's a yes, it's not a sure or an okay. Specific, so this relates to informed. Everybody is specifically consenting to certain things. And sober, so no alcohol or drugs in the system. That does make you incapable of giving consent. Family Pact. So Family Pact is a state-funded program that provides services related to reproductive health, family planning, as well as contraceptives and preventative screenings. So if you were to qualify for Family Pact, you could get free STI screenings and treatment, HIV testing and counseling, Pap smears, emergency contraceptives, and different birth control options. How to qualify for Family Pact is you would meet at the Student Health Center with our Family Pact coordinator, who would see if you qualify on one of the 3 factors. Number 1 is you meet a certain financial requirement. Number 2 is you have a lack of insurance, or number 3 is confidentiality. So let's say you're on your parents' insurance and you want to get on birth control without them knowing about it. You could qualify for Family Pact on confidentiality. Condoms and special barrier requests. So TitanWell has a free condom program that is called the CAP program, the Condom Availability Program. And we have a link to request condoms and special barriers. The link is the bit.ly link on the screen. However, there also is areas to just pick up free condoms at the Student Health Center. There are 2 areas. One is to the left of the pharmacy. So when you walk into the Student Health Center, there's big double doors. To the right is the pharmacy. To the left is the condom dispensers. It's called the Condom Corner. And there's also another condom corner in the green waiting area, which is by the lab. So if you, let's say, are getting tested for STIs, you can grab some condoms and some handbills at the green waiting area. Here we have some on-campus resources that you can utilize. Student Wellness and TitanWell are who we are. So we do outreach on campus through the TitanWell Hut, which you can follow on Instagram to see what topic it will cover and where it will be throughout the week. And Student Wellness is the Student Health Center located by the dorms in the corner of campus. We have Dirk, which is on the 1st floor of the Pollock Library, the Women's Center, which is on the 2nd floor of Gordon Hall, Tuffy's Basic Needs, which is on the 1st floor of McCarthy, and we also have Titan Recreation Center, which is the gym on campus near the State College parking lot. Here are some specific sexual health resources. We have Student Wellness again, the Orange County Health Department, the Center OC, Centers for Disease Control, Planned Parenthood, Go Ask Alice, which is actually a really great question and answer website that's run through Columbia. A lot of people ask a lot of different types of questions. So if you ever have a question, I would recommend going to that URL and seeing what the answers have been. And also Bedsider, which is an app we recommend for birth control resources. It has a really great interface where you can compare 3 different forms of birth control to see what the pros and cons of each are, what you like about each one and what you don't like about the other. And it also has videos of people who have been on that birth control method saying what they like and don't like about it. And also on the right, we have the 2 bit.ly diagrams that we showed earlier about STIs and birth control. Here's our post test. You can scan it on your phone with the QR code, or you can type the bit.ly link into your browser. It'll take about 3 to 5 minutes to complete. Thank you so much for listening to this presentation. And if you want more information, feel free to look us up on Fullerton.edu/student wellness or check us out on Instagram at TitanWell.